Hello, hello, hello. Dr. Perkins here. Welcome. Today we are talking about how to get rid of a yeast infection. Such a very common thing. And so I'm so excited to dive in, and I'm more excited that you're here with us today. Come on, let's dive on in. So in this video today, we will be talking about yeast infections. We'll be diving pretty deep into this topic today. With that, we're talking about the diagnosis of yeast infections, what types of things may increase the likelihood of you getting one, treatment options for yeast infections, home remedies for yeast infections, as well as those that you can take over the counter and prescribe, and how to tell if you're having a severe form of a yeast infection. Let's talk about a yeast infection. Super common infection, happens to about 75% of females in the reproductive age, really comprising of about 1.5 million visits to the doctors every single year. And that does not include all those who experience a yeast infection and may not go to the doctors to get treatment. This is a lot of yeast infections. They're so common that I want you to be aware of them and to be comfortable with identifying your symptoms, how to get treated for them, and be comfortable seeing your provider and talking about these things as well. So what is a yeast infection? Well, it is an infection that is of a fungal nature that happens in the vaginal area. The medical term for this is candidiasis, okay? So you may see on a report or hear of these things being referred to as candidiasis infection. And you may have also heard of other infections that are very similar, like thrush. Babies have thrush. Men may have infections that are caused by yeast as well, or candida in the vaginal space. Because this is an OBGYN's world here, we talk about the GYN stuff, we're focusing just on a yeast infection, which usually refers to the female version of the infection in the vaginal tract. And so with that, being that is so common, it is important to know the symptoms and know how to treat it. In general, yeast infections won't kill, right? In general, they're very curable infections. And it really takes just a few days after starting the course of treatment for it to be completely gone. And so with that, just know that they're very simple, but also it can be aggravating or very irritating when you have the infection and it not be treated. What are the symptoms of a yeast infection? The first is that you may feel a lot of vulva irritations down there. It just feels raw. It feels painful. When you touch the area, it is very sore. If you take a look, it can be very reddened. If you're having sexual intercourse, it may feel so inflamed and enlarged that it's very uncomfortable and sometimes even painful. Sometimes a yeast infection can hang in the area for so long untreated that it may also cause cracks in your skin, which may lead to bleeding or spotting. And that can happen with or without intercourse, with or without tampon usage. This can even be a problem when giving birth. The area becomes so inflamed. And so if you start having symptoms, you really are advised to see your doctors, have them do some testing, and know for sure if you're having any kind of infectious processes happening down below. Now, if you do have a yeast infection, you may be treated by prescription versus over-the-counter medicines that you can get at your local pharmacy versus things that you can get that are not necessarily in a pharmacy, but can really actually help with clearing an infection if you do have one. As far as using prescriptions, this may come in a couple of different forms. The first is that you may be prescribed a pill that is a 1-dose pill. You take that pill and a majority of patients will have complete cure of the yeast infection. And that pill is often referred to as diflucan. There are also other medications as well, because a yeast infection may have different strains of yeast present, and sometimes they may be a little bit resistant, so there are other antifungal medications that can be used instead. But in general, the one pill, diflucan, is enough. If you have recurrent yeast infections wherein experiencing this every month, a few times a year, your doctors may give you a double dose of the medicine that you'll take about 72 hours apart just to give your body enough support and completely clear the infection. You can also have a prescription for a vaginal cream. There are several different forms. Depending on your status, whether or not you're pregnant, we may give you a certain type of vaginal suppository. They all work quite well, and literally within a few days of getting your treatment, you will be cured of the yeast infection. On the other hand, you may want to explore options at the pharmacy that may help to get rid of your yeast infection without necessarily going to the doctor's office, getting an appointment, sitting in the waiting room, getting examined, waiting for a test result. You can actually try these treatments at home on your own without much harm. In the US, our common medicines of this type would be called Monistat. And Monistat may come in different regimens where you can have a 1-day treatment, a 3-day treatment, a 5-day treatment, or a 7-day treatment. They all work just as effectively in curing your infection. It all breaks down to how often you'd like to place the medicine and how you'd like to deal with the treatment process. So think about this. If we're using a cream vaginally to clear an infection, if you're walking around and moving around the house, you're doing things, you're living your life, gravity will pull this cream out the vagina. And so because of that, you may have a lot of discharge as you're getting treated with this. And so determining how long you like to use this treatment is going to be really important as far as what your days are going to be like. A couple of things I would recommend. The first is to make sure that you're wearing cotton underwear. If you need to use like a liner or a pad to absorb some of this cream as it comes down, then I would absolutely recommend that. Be sure to use it at night right before you go to bed. The reason is you want to place this in the vagina when you know that you'll be in bed for quite some time. That way, gravity isn't pulling the medicine out right away and you're actually being effectively treated. And on that note, I would also say with these over-the-counter meds, it is super important that you insert the suppository or the cream all the way inside the vagina. Because if you insert it just on the outside of the vagina, we're not getting full treatment because the rest of the vagina upwards will not get any of the medicine that is needed to clear the yeast that is there. So insert that suppository or that cream all the way in, almost like a tampon, release it, go to bed, stay in bed for a few hours, and then you can be pretty reassured that the treatment is going to be effective for you. So those are my top tips with treatment. Again, if you have any comments, experiences with this, go ahead and drop it below because I'd love to hear your story. And listen, here in this community, we love to share and help each other. So if you've experienced one or have a preference for either medicines, let us know. And while you're at it, like and subscribe, all right? Now, I've been asked many times, well, Dr. P, which treatment option is the fastest? They actually work pretty well and very similarly. That's considering the pill or the suppository. Within 24 hours of starting the treatment, most people will start to feel a relief in their system, which is great because we don't want to stay with these yeast infections forever, but they really work just as well. And so you won't go wrong with either version or dose or route of treatment. Another question that I often get is, how do we know if my yeast infection is a complicated one or a very severe form of yeast infection? And so there are several different ways or guidelines that we use to kind of determine this. A very severe or complicated yeast infection often will spread and affect more systems. So instead of it just being right by the vulva or in the vagina, it could actually now spread to your upper areas inside of your abdomen and your pelvis, causing more problems. Now, if you are a healthy, young female without any issues or what we would consider to be it being immunocompromised, that means you have an immune system breakdown. If you're not in that category, you're probably having a regular, normal yeast infection. So who would be immunocompromised? Someone with HIV, for instance, may have a weakened system. Someone who may be on steroids for a while, they may have a weakened system as well. If you've been treated for cancer with the oncologist and you're on radiation therapy or you're getting chemotherapy, your system may be immunocompromised as well. And so these categories would be, if you were to have a yeast infection at the same time, these will be considered complicated or severe versions. Now, some people also may just have the yeast infection spread to say their entire vulva, perineum, groin, the mons pubis, where you have like your pubic bone, your thighs, and the entire area is infected with this yeast. That may also be considered a severe infection. Now, in these scenarios, treatment really needs to be prolonged. Sometimes you may need treatment for months or weeks, because it takes so much more medicine to kind of clear that infection because it's so much more complicated. So now that we talked about getting treatment that could be either prescribed or over the counter, there are other options as well. And so you may have heard of using things like essential oils or yogurt and just so many other things. And you can explore some of the other videos on my channel where we talk more about yeast infections and other ways that we can go about treating it, whether or not it's supported by the FDA or evidence-based medicine is a different story, but I talk about those in some other videos, so you can go ahead and check those out. But in general, one thing that I will say works quite well, and it is supported by evidence-based medicine, is boric acid. Boric acid is never to be taken by mouth. So I'm going to start out by saying that if you're considering using it, have used it, have it in your household. You want to make sure that this is stored away pretty well, that it stays away from kids and children, and that you never ingest it by mouth because it literally can be a poison for your system. But once you use it vaginally, it is not a poison and it doesn't hurt your system at all, okay? Boric acid will come in general, about a 600 milligram capsule that you'll place in the vagina. And so for those people who suffer from recurrent infections, I mean, you're having this a yeast infection almost all the time, like constantly, from your periods, from sexual activity, from being in a wet swimsuit for a long time, from working out, so many different things can cause recurrent infections. And if that is your experience, you may want to help to prevent a yeast infection from happening by using boric acid, or if you currently have an infection, you can use it for a treatment as well. And so in general, I would recommend using one suppository in the vagina at night for about 2 weeks. And this should help to clear your infection right away. Now, boric acid is not a prescription, and this is something that you can use. You can order it from Amazon, order it online, whatever works for you. You can get it from many different areas like stores and things like that, but it is not a guaranteed treatment. It is a home treatment that you can try and see if it's effective for you. And our research shows that it can be as effective as the prescriptions that we give, right? So lots of different options for how to treat a yeast infection. And if you do it effectively, it works. So the last thing that I'd like to mention before we come to a close with this video today is that if you question whether or not your treatment was effective, I recommend that you see a provider, have them test again, have them do a test of cure to make sure that your symptoms and your infection has completely cleared. But I also want to say that you want to give your body enough time to actually clear it once you start the treatment. Oftentimes we want things really super fast. It's great when we have quick relief, but really we want to give your body time to clear it. And so that may call for having at least 7 days from the initiation of the treatment for your symptoms to be completely gone and the infection to be completely cleared. So give yourself a little bit of time, a little bit of grace. Take care of the vagina and the vulvar space so that your body can be its best. I hope that you've learned something today and you've enjoyed our conversation. And if so, leave a comment below and let us know. I do want to offer you a free copy of my ebook, Hormones Don't Lie. In this ebook, we dive into the hormones and things in our female system that helps us be our best and things that can harm us as well. And so if you like that, click the link below and I'll be more than happy to send that over to you. Thanks for being here today. I'm Dr. Perkins, a board certified OBGYN, and I'm super passionate about teaching about your body, my body, our bodies, so that we can be greater together. Thanks for being here.